Hi, my name is Anthony Marin. I'm a certified specialist in reproductive endocrinology and infertility in private practice with Janaea. So firstly, just to cover off what is the definition of infertility. If you look at couples that are trying to conceive spontaneously, 83% of couples will be pregnant at 12 months. That number begins to plateau and is about 92% at 24 months. And then it plateaus right out and it's 93% at 36 months. That doesn't mean to say that couples who have been trying for 36 months or more can't fall pregnant, but for whatever reason, the likelihood of them falling pregnant is very low. Most couples will achieve a pregnancy within the first 6 to 12 months. When we look at what is the definition of infertility, it's also important to look at female age. We know that as a female gets older, the likelihood that she's going to achieve a pregnancy gets progressively less. And the greatest chance of conception is when the female is in her mid-20s. This number slowly declines down to about 35 and then much sharper. The reason for this is there is a decline in egg numbers, but more importantly, there's a decline in egg quality. And that means that there's an increase in the risk of chromosomal abnormalities, leading to lower pregnancy rates and higher miscarriage rates. So for all intensive purposes, the definition of infertility is where a woman who is less than 35, who's been trying to fall pregnant for 12 months or more, or for a woman who's more than 35, has been trying to fall pregnant for 6 months or more. Primary infertility refers to the situation where the female has never been able to achieve a pregnancy, and secondary infertility is where she has achieved a pregnancy in the past but can't now. Infertility is common and it affects 1 in 6 couples. So the second thing to go through is the causes of infertility. The causes are broken down to either male factor, female factor, a combination of the two, or unexplained. In regards to male factor, there's either a problem with the numbers or the quality of the sperm, or the male can have difficulty with either erection or ejaculation. From a female factor perspective, there's either issues with ovulation, one or both of the tubes may be blocked. There can be other issues in the pelvis such as endometriosis, or there can be problems with the uterus or cervix. With the combination, so that's where there may be, for instance, mild male factor, and from the female perspective, one of the tubes are blocked. And frustratingly, in up to about 20% of cases, there's no obvious cause of the infertility, and that's what we term unexplained. So thirdly, just to go through the investigations of the infertile couple, starting with the female, the fertility specialist normally sits down with the couple and goes through a history and examination of the female and also the male. From a female perspective, we do a pre-pregnancy set of blood tests. So that's looking at things like immunity to rubella and chickenpox, and also looking at hepatitis B, C, and HIV serology. We normally also like to do a hormone profile, and specifically we like to do a blood test called an anti-Müllerian hormone, or an AMH. This blood test is quite good at telling us in regards to how many eggs are in the ovaries, so a quantitative perspective of a woman's ovarian reserve, but it's not very good at telling us what the quality of those eggs are or the likelihood that that couple will achieve a pregnancy spontaneously. We also like to do a good quality pelvic ultrasound to make sure that the ovaries and the uterus look normal. Depending on what's found on history or examination, there may be some other investigations that we do for the female. In terms of investigating the male, in addition to the history and sometimes the examination, we normally also get the male to provide a semen analysis, and that's to look at the numbers of sperm, to tell us some idea what proportion of the sperm are moving, and also to give us some idea in terms of how the sperm look under the microscope and what the quality of the sperm are. After the initial consultation and a series of investigations are done, then we normally regroup for a second consultation to go through those results and to determine if any causes of infertility can be identified. Thank you for watching today's video. If you would like further information or to discuss your current situation, feel free to get more information on our website, marincampbellmackey.com.au, or telephone to make an appointment. Thank you.